Hi, my name is Jonathan Broad. I'm an academic foundation doctor at Torbay Hospital, and I'm going to talk to you a little bit about public and community health in Cuba, which was the experiences that I had as part of my elective in Cuba and in Colombia. I'd like to thank the Royal College of GP, the University of Bristol Faculty of Public Health, Drs Jewell and Siassakos for their kind support and supervision of the project. So my elective had three overlapping themes. One was about community and public health, one was about maternity, and one was about addressing health minorities and health equalities. And just to talk to you a little bit about the background of Cuba and primary care in Cuba. Cuba in the post-revolutionary period had a massive focus on primary care as the way of achieving universality and free access for healthcare for everyone. They massively expanded something that they called the polyclinic. So there are now 500 of these polyclinics, and they're multidisciplinary centres which combine GP-led services, including a minor admissions, a minor emergencies unit, as well as dermatology, ophthalmology, and even some social services, all combined within one centre, which is run predominantly by GPs. So I thought it would be interesting to do some comparisons of health statistics, and the expenditure per overall GDP in Cuba is much lower than in the UK, and interestingly it's a much higher expenditure on primary care as a proportion of their of their healthcare budget. And this has really been lauded as the reason why they have health indicators that match many high-income countries despite itself being a low-income country. So I've included some pictures of polyclinics. The first one is of the minor emergencies room. The second one is of the laboratory. So these mini polyclinics include the ability to run just some basic lab. And this is probably my favourite picture, which is the mapa epidemiológico, which outlines the local disease burden in the area. And I'll talk a little bit about that later in the context of GPs doing active outreach in the community. Finally, this picture demonstrates something which I found amusing, which is just to say that Cuba faces the same public health difficulties as any other country, and this is a picture of some greasy pizza and omelette snack bars that were just outside the GP practice. So I'd like to talk about the el consultorio, or the appointment with the GPs. So interestingly, GPs lived in the centre. They have 24/7 care in theory, which is obviously a hot topic in UK politics, and which I particularly enjoyed. GPs are entitled to a 30-minute appointment with their patients, although it definitely didn't always happen like that, but in theory they're at least entitled to it. The fact that GPs lived in the centre lent itself to a quite blurred line in terms of what the professional and what the professional boundary might expect it to be, and it was quite commonplace for me to see the spouses of GPs or local market vendors coming into the GP practice, doing some local bartering with the GPs and their patients during a consultation. Lastly, I just wanted to talk about the focus on promotion and awareness in the GP practice. So I showed you the picture before of the mapa epidemiológico, and essentially this maps out the community and their health burdens, and GPs go and knock out on every door in their community and see how the patients are doing, help manage their chronic disease, help run some health promotion activities, and this is a really inspiring component of healthcare. I'd like to just talk briefly about maternity and primary care. So maternity is really a central focus, and it's run by GPs in Cuba. One of the services they run are residential services for women that are at risk. So this includes women that have social problems, or as well as women that have mild anemia, hypertension, that are overweight or underweight or underaged. And these services include things like free housing for the entirety of their pregnancy, food and a chef that lives in-house, transport, and a doctor and a nurse, and that's a GP-led service as well. That's a really fantastic example of maternity in primary care in Cuba. So I just included some pictures. This is one of my favourites again. It's a picture of an old colonial mansion that's been taken in post-revolutionary Cuba has used it for health services for women and children. This is a different residential maternity service, and this is the garden that women and patients use. And these are some pictures of health promotion in maternity within these residential maternity services. So my reflections from my experiences in Cuba were as follows. Firstly, I was quite inspired by the emphasis on primary care within Cuba, and especially on preventative medicine. Particularly notable were the proactive community approach and GPs going out into the community, knocking on the doors, as well as these maternity residential services, which I think are a fantastic example of preventative medicine. And finally, I noticed that Cuba's healthcare is universal and sustainable, and I think this is a really good example of a low-income country not pursuing things like structural adjustment, things like for-profit health services in a means to make an excellent healthcare service. If you have any questions, please feel free to get in touch. Thank you.